Do you hear a constant ringing in your ears that won't leave you alone and want a simple way to ease it? Stay with me, because today I'm going to show you a 30-second technique you can do yourself that has helped many people reduce that annoying noise. But first, you need to understand what's happening inside your body and why that sound appears. Close your eyes for a moment, just a moment. Imagine a sharp, continuous ringing inside your head that never turns off. It doesn't matter if everything is quiet, if you play music, or if you try to cover your ears, the sound is still there. It doesn't come from outside, it comes from within you, and no one else can hear it. This is what millions of people experience every day. It's called tinnitus, and it affects hundreds of millions of people worldwide. For some, it's mild, but for many others it becomes a serious issue that disrupts sleep, concentration, and peace of mind. What's most concerning is that most people don't know why it happens or how to manage it properly. You may have even heard the discouraging phrase, "You just have to live with it." But let me tell you something honestly, that's not the full truth. There are real ways to relieve it, and one of them is a very simple technique you can do with your own hands in less than 30 seconds. You don't need expensive medications, complicated devices, or invasive procedures. It's practical, accessible, and best of all, you can start right now, wherever you are. I'll walk you through it step by step shortly, but first I want you to understand why your brain creates this ringing, what common mistakes may be making it worse without you realizing it, and the hidden causes that are rarely explained clearly. Here's something important. One cause is linked to years of accumulated noise exposure. Another might be closer than you think, even something you use daily. And the last one doesn't directly involve your ears and is often the most overlooked. Stay until the end, because that's where everything comes together and where you'll learn the technique that can help you regain calm, especially during those nights when silence feels like your enemy. I'm Dr. Gabriel Mena, and I've spent over 2 decades treating patients with this condition. And if there's one thing that has deeply impacted me, it's seeing people exhausted, with tired eyes, telling me they haven't slept well in weeks, or even months, because of that constant noise in their head. I remember one patient in particular, a 60-year-old man who stopped attending family gatherings because background noise made his ringing unbearable. I've also treated people who can't enjoy a simple conversation because the sound won't let them focus. These are real, human situations, and more common than you might think. Many people come after seeing multiple specialists, after tests, vitamins, and general advice, but without clear answers. That's what pushed me to dig deeper, to study, to review scientific research, and truly understand what's behind tinnitus. What I discovered completely changed the way I help my patients. Because tinnitus is not an unbeatable enemy. It has causes, it has mechanisms, and it can be managed. I'm not talking about miracles, but about real, practical strategies within anyone's reach. If this is helping you understand what's happening to you, consider subscribing to the channel and sharing this with someone who might need it. Sometimes, one video can truly make a difference in someone's life. Now, there's something fundamental you need to understand. Tinnitus is not a disease, it's a symptom. It's your body's way of telling you something in your auditory system isn't working as it should. And that changes everything, because if it's a symptom, it has a cause, and if there's a cause, there's a way to address it. Inside your ear, there are tiny cells called hair cells. Think of them like delicate piano keys. Each one responds to different sounds. When you hear something, these cells vibrate and send signals to your brain, which then interprets what you're hearing. But when some of these cells are damaged, something unusual happens. It's like a piano key getting stuck. It keeps playing even when no one touches it. That's tinnitus. Your brain receives a signal that shouldn't be there, but it interprets it as a real sound. Sometimes it sounds like ringing, buzzing, whistling, or even crickets. Each person perceives it differently, but they all share one thing: it doesn't stop. Here's something many people don't explain. In many cases, the origin isn't just in the ear, it's also in the brain. Areas related to attention, emotions, and memory become overactive. It's as if your mind locks onto that sound and can't let it go. That's why stress makes it worse. That's why anxiety intensifies it. And that's why at night, when everything is quiet, the ringing feels louder. Your brain tries to hear something, and all it finds is that internal noise. Studies have shown that the brain of someone with tinnitus perceives silence differently. What is restful for others can become the moment when the sound feels strongest for you. But there's hope. Just as your brain learned to amplify that sound, it can also learn to reduce it. And that's exactly what we're going to start working on. Now let's talk about one of the main causes, especially in people over 50, and one of the most overlooked. Throughout your life, your ears have been exposed to thousands of hours of noise. Work, traffic, tools, loud music, busy environments, it all adds up. Even if you don't feel it immediately, the damage accumulates. It's like filling a glass drop by drop for years. Eventually, it overflows, and that overflow often shows up as tinnitus. I've seen clear cases, like a 62-year-old teacher who spent decades surrounded by noise. When he retired, he expected peace, but instead, a constant ringing appeared that wouldn't let him rest. His hearing seemed relatively normal, but internally there was accumulated wear. His brain was trying to compensate for lost frequencies, creating that sound. What can you do? Protect your ears. Avoid prolonged exposure to loud environments. Use protection when needed. And most importantly, give your ears time to rest. Another surprising cause has nothing directly to do with the ear, but with something you use every day, your jaw. There's a joint right next to your ear that activates when you talk, eat, or yawn. When you clench your teeth, often without noticing, it creates tension. This is called bruxism. Many people do it while sleeping or during stress. That constant pressure causes inflammation that can directly affect the auditory system. The result, a ringing that may change depending on how you move your jaw. If you've noticed your tinnitus shifts when opening your mouth, this could be the cause. And this is just the beginning, because there are still more important factors to understand before we reach the technique that can help you. I remember a 58-year-old patient, a retired accountant and grandmother, who came in very distressed. She had months of constant ringing that prevented her from focusing or enjoying her days. All her tests came back normal, but she didn't feel normal. When I examined her, I asked her to slowly open her mouth. There was a small click. Her jaw muscles were tender. She also woke up with headaches almost every day. That was the key. She had nighttime bruxism. That pressure was inflaming the jaw joint near the ear, irritating the auditory system and causing the ringing. I recommended a simple plan: a night guard, jaw relaxation exercises, and warm compresses before bed. Within weeks, her headaches disappeared and the ringing became occasional instead of constant. It went from unbearable to manageable, and she regained her peace. Now ask yourself, could something similar be happening to you? Try this. Place your fingers in front of your ears and slowly open and close your mouth. Do you feel a click or discomfort? If so, your jaw may be playing a role. During the day, notice this: your lips should be closed, but your teeth slightly apart. If you catch yourself clenching, consciously relax your jaw. Before bed, apply gentle heat to both sides of your face for a few minutes. And if you suspect nighttime clenching, consult a dentist. A simple mouth guard can make a huge difference. Now here's something that deeply concerns me as a doctor. It's silent, common, and often overlooked. Certain medications can affect your hearing, and you might be using them without knowing. There are over 200 drugs known to impact hearing. This is called ototoxicity. Many are commonly used, especially after age 50. One of the most common is ibuprofen. It seems harmless, but frequent use has been linked to hearing issues. And when hearing is affected, tinnitus can follow. It's not the only one. Some antibiotics, diuretics, and other medications can also disrupt the delicate balance inside your ear. Inside your ear, there's a special fluid that allows signals to be transmitted properly. Some medications alter this balance, causing the hearing cells to malfunction. The brain then receives mixed signals, and you perceive that as ringing. I once saw a 67-year-old patient who developed tinnitus after a medical treatment. No one warned him about the risk. By the time the ringing appeared, the damage was already done. So remember this: don't self-medicate long-term. If you need medication regularly, talk to your doctor. Ask questions. Stay informed. And if you already have tinnitus and take medication, don't stop on your own, but do consult. Sometimes a small change makes a big difference. Now let's talk about something many people don't connect with tinnitus, your circulation. Your inner ear depends on a constant blood supply. It needs oxygen and nutrients delivered through a very small artery. If that flow is reduced, your ear suffers. High cholesterol, high blood pressure, uncontrolled blood sugar, and a sedentary lifestyle can all affect circulation. When blood flow drops, ear cells weaken, and tinnitus can appear. I had a 58-year-old patient with these issues. His hearing wasn't severely affected, but his circulation was poor. With simple lifestyle changes, better diet, more movement, his overall health improved, and so did his tinnitus. Sometimes tinnitus isn't just about the ear, it's about your whole body. Improve your circulation, and your ear benefits. Start simple, check your cholesterol, control your blood pressure, eat more natural foods, reduce salt and sugar, and walk daily. Now we reach the final cause, the most silent and overlooked. Stress and anxiety. Stress doesn't just worsen tinnitus, it can fuel it. When your mind is under constant pressure, it changes how it processes sound. The part of your brain that should ignore irrelevant noise weakens, while the alert system becomes overactive. The result, that ringing takes center stage. It becomes a cycle. Sound creates anxiety, anxiety amplifies the sound, and so on. But there's a way out. I remember a 63-year-old patient who told me, "This sound is stealing my peace." His tinnitus started mild, but during a stressful period, it intensified. We worked on retraining his brain to stop reacting with fear. One tool was conscious breathing. Inhale for 4 seconds, hold for 7, exhale for 8. Repeat several times daily. Another strategy, avoid complete silence at night. Use soft background sounds like rain or ocean waves. This gives your brain something real to focus on. Also, seek support if needed. It's not weakness, it's smart. And move your body. A simple 30-minute walk can reduce stress and improve circulation. Many patients notice their tinnitus decreases during and after walking. Finally, protect your sleep. Keep regular schedules, avoid screens before bed, and use the breathing technique if needed. Now, the moment you've been waiting for. The 30-second technique. It's simple, free, and you can do it right now. Many people experience immediate relief, even moments of silence. Here's how. Cover your ears completely with your palms, creating a gentle seal. Place your fingers on the back of your head. Rest your index fingers over your middle fingers, then gently snap them down onto your head, creating a rhythmic tapping sound. Repeat this 40 to 50 times, about 30 seconds. Then slowly remove your hands and listen. Many people notice immediate relief. Some experience brief silence. Even a few seconds can restore hope. You can repeat this several times a day, especially before bed. One patient once told me, "For a moment, the silence came back." And that changes everything. Be patient. Not everyone feels the same effect immediately. Practice it for several days. And remember, if your tinnitus started suddenly, affects only one ear, or comes with dizziness or pain, seek medical attention. Tinnitus is not a life sentence. There are causes, solutions, and tools that can help you regain your peace. There's a big difference between having tinnitus and letting it control your life. If you know someone going through this, share this video. It could change their life. And before you go, take a moment and be grateful for your life, your body, and the chance to learn and improve. Here, with Dr. Gabriel Mena, we're truly committed to helping you care for your health and build better habits. Tomorrow, there will be a new video made especially for you. I'll be waiting for you.